Hi, in this video, we will discuss the pre-op diet. So you've been scheduled for your surgery, you've probably already attended pre-op class, and maybe feeling like you need a little review about how to follow the pre-op diet correctly. So in this video, we will discuss how to prepare for and how to follow the 2-week pre-op diet. So you may be asking yourself, why do you have to follow a pre-op diet? The pre-op diet is considered a liver shrinking diet. During the procedure, we have to move that liver aside using a tool called a liver retractor, just getting it out of the way so your surgeon can do surgery on your stomach. And the pre-op diet helps your liver to be in the best condition it can be. It helps to make it smaller and softer. It helps to decrease the overall risk of complications such as bleeding or leaks. It leads to a shorter, safer recovery period. And sticking to the pre-op diet starts you on new dietary habits required for long-term weight loss. In the next several slides, we are going to discuss what you are to eat and drink on the 2-week pre-op diet. During your pre-op class, you will be provided a form that tells you exactly which day to start your pre-op diet. Each day, you will do the following things. You will have 3 protein shakes each day. Now, while you're making a protein shake, you're going to use 1 full scoop of your Undri or Nectar protein, and you will use 8 ounces of liquid. That liquid can be water, or it can be milk, which needs to be skim, or 1% milk. You may also use unsweetened soy milk, fat-free 1% lactose-free milk, but you should be consuming at least 60 grams of protein from your shakes each day. So getting 3 shakes a day will fulfill that 60 grams. You'll eat 1 serving of each of the 6 foods on your list daily. You'll choose from items listed only. No other foods are allowed on the pre-op diet. On the next few slides, we'll discuss these 6 foods. You will also drink at least 64 to 80 ounces of non-carbonated, caffeine-free, sugar-free clear liquids. And this is going to help you stay hydrated. You will eat 1 serving of each option listed below every day. You'll have a half a cup of cooked plain cream of wheat, oatmeal, or grits, and these are to be made with water. You'll have half a cup of sugar-free pudding, 4 to 6 ounces of fat-free yogurt, but it cannot be Greek yogurt, 1 cup of prepared low-fat soup, a half a cup of unsweetened applesauce, and 1 cup total, baby carrots, celery, cucumber, broccoli, tomato, or iceberg lettuce. And with that 1 cup of vegetables, you're allowed to have 2 tablespoons of fat-free dressing. Examples of what you're allowed are in your green pre-op diet packet. If you have questions, please call the office because we're here to help you. In the next few slides, we'll discuss each of these 6 foods. So let's go through each of these 6 foods and some examples that you can find at your store. The first item on the list is half of a cup of cooked plain cream of wheat, oatmeal, or grits, and this needs to be made with water. Down at the bottom here, I've given you the examples of what you can find at a store near you. But remember, it cannot have butter. You cannot make it with milk. It needs to be made with water. I think it's easy to find the microwavable packets. It's already portioned out to the half a cup a serving. And it's just easier if you're on the go or taking it to work or you're busy at home to have the packets. But again, check out the examples that you can buy at your store. The next item on the list is a half of a cup of sugar-free pudding. Down at the bottom, you'll see examples of what you can find at your store, but here are some pictures. If you buy the Snack Pack or the Jello brand sugar-free pudding, it's already portioned out to the half of a cup or 4-ounce servings for you. Or if you buy the zero sugar instant pudding, you just need to make sure you are measuring out your serving size. The next item on the list is 4 to 6 ounces of fat-free yogurt. Needs to be fat-free, low sugar. Cannot be Greek yogurt, and you can only have 1 serving per day. I will talk about substitutions in a future slide, but at the bottom of this slide, it gives you some examples such as Dannon Light and Fit non-fat yogurt, Kroger Carb Master yogurt, Activia Light, Yoplait Light, or Friendly Farms Light. They all should be able to be found at a store near you. Soup is the next item on the list. You get 1 cup of fat-free or low-fat soup. Now, on the pre-op diet, it may contain noodles or rice, but when you're choosing your soup, you need to look at the nutritional label and make sure per serving it is 5 grams or less of fat and 15 grams or less of carbohydrates. So if you look here, I have the light Progresso chicken noodle soup. The picture next to it is the nutritional label, and they have the per serving and then they have per can. So you need to check the per serving, which is 1 cup. You need to check the fat and make sure it's 5 grams or less per serving of fat and 15 grams or less of carbohydrates. The other example I have shared on here is cream of chicken. If you have decided to do a condensed soup, you have to make sure you're doing half of a cup of condensed soup with half of a cup of water, which would equal 1 full cup. Again, it needs to be 5 grams or less of fat and 15 grams or less of carbohydrates. And at the bottom of the screen here, I do have some examples. You also need to avoid Campbell's Chunky. 1/2 cup of unsweetened applesauce. Now, if you decide to buy a larger jar of applesauce, you need to make sure it's unsweetened and you need to make sure you're measuring out half of a cup. They do have the cartons with the small cups, and they're already measured out to about 4 ounces each. Down at the bottom, I do have some other brands that are examples that you may be able to find at your store. And last on the item are your vegetables. You get 1 cup total of baby carrots, celery, cucumber, broccoli, tomato, or iceberg lettuce. You also get 2 tablespoons of fat-free dressing. Now, these can be any brand, and they can be fresh or cooked. So let's say you want to make a salad. You can use a little bit of iceberg lettuce with some baby carrots, some celery, and maybe tomato. But all of that needs to equal 1 cup. Or maybe you decide just to have 1 cup of baby carrots, or you can do half of a cup of baby carrots and half of a cup of broccoli, and you can dip it in a fat-free ranch. Remember, that's only 2 tablespoons of fat-free dressing. On an earlier slide, I mentioned substitutes. You are allowed 1 substitute per day. So let's say you don't like applesauce and you choose to have 2 cups of soup that day. So you would not have your applesauce that day, but allowed to have 2 cups of soup. Let's say you don't like yogurt. You don't have the yogurt on those days, but you can have 2 of something else on the list. The only thing you're not allowed to double up on is the yogurt. You're only allowed 1 yogurt per day. You are allowed to use herbs and spices to help enhance the flavor of the food. So any calorie-free sugar substitute or sweetener can be added, such as Equal, monk fruit, Splenda, stevia, Sweet and Low, or maybe Truvia. You may not add regular sugar, no agave, no coconut sugar, and no honey. Other herbs and spices or extracts can be used for additional flavor and just to help with the variety, such as basil. You can add cinnamon, you can add mint, or maybe something like a peppermint extract or vanilla extract. So just you can be creative and help enhance the flavors of your food. While on the pre-op diet, there's no chewing gum and no sugar-free candy. The day before your surgery is clear liquids only. Check out page 4 of your green pre-op diet papers for a more extensive list, but I've shared some items here. So the day before your surgery is clear liquids only. That's no protein shakes and no solid food. Here are some examples. Again, check out page 4 for a more detailed list. Get plenty of fluids that day. You want to be nicely hydrated going into your procedure. So the day before your surgery, if you can have a couple Gatorade Zero or Propel or Powerade Zero, that will help you be nicely hydrated going into your procedure. Once midnight comes, nothing to drink after midnight. The morning of your surgery, there is no food, no drink, and no medications by mouth. So nothing by mouth the morning of your surgery. I hope this video was helpful in explaining the pre-op diet. If you have any questions at all, please feel free to call the office at 513-682-6980. We are here to help. Now that you have reviewed the pre-op diet and you feel ready, check out some other videos. You may find them helpful to get you ready. There's one, your surgical experience before, during, and after. That will help you get prepared. And also hydration education. That will help you stay nicely hydrated during and after your procedure.